Welcome. This is Conversations with Black Doctors, brought to you by Austin Black Physicians Association, also known as ABPA. The mission of the Austin Black Physician Association is to improve health disparities within our community and to inspire and nurture the next generation of Black doctors. The purpose of these webinars is to bring health information to our community from trusted voices in the Austin area. We want everyone to have the knowledge to care for themselves in the best ways possible. If you're interested in learning more about or collaborating with ABPA, please visit austinbpa.com. That's austinbpa.com. And please feel free to share.
Thank you for joining us. Today we have Dr. Chinwe Eferibe, an adolescent medicine physician. We're going to talk about diabetes. Dr. Eferibe, thank you for being here today. Can you tell us a little bit about why we're talking about diabetes? Why is it important for you?
Thank you, Dr. Hutchison, for this opportunity. November is National Diabetes Awareness Month. And for me, as a pediatrician and adolescent medicine specialist, I think I'm always kind of in tune to when we talk about certain health conditions, especially chronic conditions. And whenever the topic of diabetes comes into play, the main target are usually adults, right? It's like, oh no, there's this percentage of population of adults who have diabetes, who are going through certain treatments, and it's very important for us to reduce the burden of disease, the cost to the healthcare system that diabetes presents. But for me, I think the reason why I wanted to have this conversation was because, the adult phase is almost towards the end of the spectrum of this condition. And I'm always thinking about, what about the young people? What about the children? What about the young adults? And in the past, it used to be that diabetes was more common in, young people who had a family history of type 1 diabetes, where it's more genetically related. But now we're finding that type 2 diabetes is actually becoming more common in youth and young adults and adolescents, even as young as 10, 11, 12 years old. And so for me, I was just more fired up to say, hey, yes, adults, it's great for us to have this conversation for you. And there's so many ways now to reverse diabetes, but can we talk about prevention or even treatment even now for youth and young adults who are suffering with diabetes? And so that was my motivation, is really trying to, be more proactive on how we can, help the population.
That's perfect. That's fantastic. Let me back up a little bit though, because there may be some people who have heard the term type 1 and type 2, but not quite sure what each is. And the way I like to help people understand it, it has everything to do with insulin. Type 1 is when your body's not making the insulin anymore. And what insulin does is it puts sugar into the cells and lets us use it. And if your body doesn't make it, you need insulin from someplace else in order for the cells to use it. Type 2 diabetes is when you have plenty of insulin, in fact, too much, and your body is not knowing what to do with it. And we didn't used to see kids with type 2 as much, but exactly like you said, we're seeing more and more young people with that second type of diabetes that often goes with being overweight, having too high of sugar, and you're just making so much insulin that your body doesn't know what to do with it. So thank you. That's really important. Other things that sometimes motivates us is when we have family members. I know I have, my grandmother had complications with type 2 diabetes, and many of us, especially in the Black community, have family members with what they call the sugar. And diabetes is just one of the issues. Is there anything else that triggers your desire to make a difference with diabetes from a personal experience?
Yeah, and same with you. I've had family members who are also either pre-diabetic or have diabetes. And so it is definitely something that hits close to home for me. And I think in the clinic, it's kind of daunting when I see patients come to me who, sometimes are overweight or are just coming in for their regular well check, their usual annual physical exams, and they feel fine. They're not necessarily having the symptoms that we're used to associating with diabetes at that point. They're not necessarily going to have to, pee very often, or hungry more than usual, or having any sorts of vision problems or sensation problems in their feet or fingers, or, or fatigue. So they're not necessarily having any of those symptoms necessarily, but we do these screenings, and which is good that we have these preventative screening labs that we do. We usually do the screening called the hemoglobin A1C. We usually do that. And for me, I think seeing so many patients fall in that range of not quite yet diabetes, but pre-diabetic, it almost kind of makes me want to find out, like, well, what else could I do for them to prevent them to get to a point that they actually become diabetic? And even though the annual exams are just once a year, there's so much evidence now looking at the importance of having more frequent contact to be able to get the lifestyle education, the physical activity education, the nutrition education that is important to make sure that we don't get to that point of diabetes. So for me, it's just seeing my patients, and then also my family connection, and seeing how we can, improve our guidance as healthcare providers.
You gave some really great tips about the symptoms, and we'll get into a little more detail, like peeing frequently, being thirsty, and we'll talk about that. But you also mentioned the word pre-diabetic. People hear that, but a lot of people aren't quite sure exactly what that means. What do you think of, and how do you define to patients what pre-diabetic is?
Yeah, I think it's almost like a way that your body is adjusting to the environment related to sugar and glucose. It's like we said, it's not quite diabetes where your body has either depending on what type of diabetes you have, but it's the ability for your body to kind of break down sugar, store it, but not store too much, and use it as needed for the energy, that your body needs to kind of expend. But pre-diabetes is just a little bit ahead of that. It's an in between before prelude, but I'm not sure. Maybe you have a better way of sharing it with your patients.
Well, you said it already. We often will do the test called hemoglobin A1C, and that's kind of the first sign that we see when there's too much sugar in your bloodstream, and that number will go higher and higher the more your blood cell sees that sugar. The other thing that's a symptom that sometimes makes us think about diabetes is we call acanthosis, so that dark area in the back of the neck or under the arms. What else do you tell families to look for? You mentioned them again, but just can you give us again, when you're talking with a family, things that they need to look out for?
Yeah, definitely. There's a study that looked at the central part of your abdomen in terms of how much extra tissue is accumulating. It's called the central adipose tissue. So that sometimes can be a sign or indicator that you're progressing towards diabetes, but not necessarily that you have diabetes if you have that presentation. But then, just looking at your growth, parameters, those who are, above the 85th percentile and 90th percentile for their weight compared to their height, usually are more likely to be at risk for diabetes or pre-diabetes. But there are certain genes that could be related, like genetic material that could be related to increased risk for diabetes. There's actually a study that looked at a gene that put folks at risk for diabetes. And they tried to see, well, is it almost like a predisposition, or are you bound to have diabetes because you have that genetic makeup? And the study looked at those who had the gene that were physically active versus those who had the gene that were not physically active. And they saw that both groups had the genetic kind of predisposition to diabetes, But for those who were more physically active, they were less likely to develop diabetes than those who were inactive. And so it goes to show us like, don't just say, oh, it's in my family, I'm bound to have it. Nothing is a guarantee, nothing has to happen. There's still things that are within your, individual control and individual power that can change the outcome. And so, just one of the things to keep in mind, and that's almost why we like to encourage lifestyle behavior changes, because there's so many environmental factors that can affect our health, but there's some things that we can, implement that may cause us to go a different direction that might be better for our health in the end.
Yeah, that's perfect. And that's a nice transition to the next part we want to talk about, like prevention, the things that we can do to prevent. And so one you obviously mentioned was exercise and activity. And that can be hard when you're already overweight or you're already inactive and you think, I can't go out and run, I can't go out and do things. So I often tell people it's starting small, just walking around your neighborhood, if you can do that. Every commercial break, do something, although most of us don't watch commercials anymore because we fast forward through it. But there are ways to increase our activity, and that's the way to start. What else do you tell people as far as prevention goes that they can do?
Most definitely. When I talk about prevention, I really think about holistic prevention, because I know most of my teens have told me that it's hard for them to know specifically what to do to prevent certain illnesses, besides like the general overview of things to consider. And even myself, I'm guilty of it. There are times when I've just said, yes, increase your physical activity and increase your healthy choices of nutrition, and then I place the referral to nutrition. I place a referral to go to the gym or go to the Y. And what we're finding is that sometimes, having a little bit more tangible recommendations, like a prescription that we would write for a drug that says take 2 tablets 3 times a day for 10 days. There's actually benefits into writing prescriptions for these preventative measures, like run 20 minutes a day, 2 times a week for 1 week, and then the next week go up to 2, so being specific is really helpful. And so if you don't mind, I wanted to share something that I think can empower, and today we're talking more to the young people, even though, their caregivers might be listening to this. I hope that you're able to share this, but.
So Dr. Ifuribe, you gave a great example of some things we can do for prevention, like exercise. Do you have other things that you recommend when it comes to prevention?
Yes, I love this conversation about prevention, because I think it's very important to approach it through a holistic kind of view, in that it's really about like doing things in a natural way that leads to healthy behaviors and healthy lifestyles. And there are about 6 domains to consider, but there are 4 approaches to those 6 domains, okay? But the main domains about prevention really is your physical activity, okay? Managing your stress, your relationships, your sleep, tobacco intake or exposure, and then eating, your nutrition. Those are the 6 really true lifestyle principles to keep in mind that really help us stay healthy. Now, I'm a pediatrician and adolescent health specialist, so my audience really is for the young people. So I'm going to speak right now, and think of it as a video game. When you're really trying to approach how you can be healthier and think more holistically, I think there are 4 levels to consider, okay? First level is where you start, like starting at level 1. I mean, I used to be a strong Super Mario Brother, all on it, Nintendo, and you got to start from level 1. And that level 1 is assessing how you are right now. What are you doing right now about your physical activity? What are you doing right now as relates to what you eat or how you eat or where you eat and who you eat with? Because it's not until you know that first level can you know how you can truly, truly recognize your game. All right. Now, if you can recognize your game, you're understanding, you know what? I'm not all that bad. There's some things I'm actually doing really well. And focus on that and say, hey, let me continue doing the strong things that lead me to being healthier. So that's recognizing your game. That's level 2. Level 3.
Let me interrupt because I'm a video game player too, and I think that's a fantastic analogy that we all have to start somewhere, and there are things that we're all good at. So go ahead with your level 3.
No worries, no worries. I'm glad you recognize it. But yeah, so recognize. So let's start level 1. Recognize your game, and then you really got to prepare for the upgrade. Okay. And I say upgrade, whether it's top up, whether it's you getting extra coins, whatever it is, you're always trying to go to the next level, right? And so you got to figure out, okay, what do I need to get in my belt, right? What areas am I lacking? What opportunities do I have to make sure that I can get to that next level, that next, upgrade? And then when you figure out what that is, you got to get reinforcements, right? So I say you got to set up your crew. Like, who's going to be with you? Who's going to be there? Whether you have to kind of phone a friend or, buddy up or link up or something, having a crew who will be your accountability partner, I think it's very important for any goal you set for yourself, because I think it's with that social support and that social network of positive influences. That's really how you'll be able to kind of keep things going and have it be sustainable into adulthood. Remember, we're talking about diabetes here. We're talking about an illness that may affect adults primarily in the end stages of it. But even now we're seeing our young people are being affected, but it's also important to do some prevention matters so that it does not have to progress that direction. And so with that, so that's kind of the overview, is the levels. Now, I get a lot of young people in my clinic, but doc, I already know I need to eat right. I already know I need to do some physical activity. I already know all of that, but like, how do I do it? Like, what specifically do I need to? I literally I had a 10-year-old come in. It's like, okay, like, so can you write down, how many steps I need to take, or can you write down how long I need to do this for? And so what I wanted to share, if you don't mind me sharing my screen, is this path to wellness wheel. I'm hoping you can see the screen well. Measuring your overall wellness using the paving wheel. Okay, this wheel is called the paving the path to wellness. It was created at Harvard Medical School by Dr. Beth Frades and her group. And basically, this is part of the lifestyle medicine curriculum that talks about like how we truly assess the different components of our health. But what I love about this is here, it gives you specific tasks and things that you can do for each section. So the instructions are basically to rate each task under each category from a scale of 1 to 5. And it means, for 1, do you never do this? Number 2, only rarely do this? 3, sometimes do this, or often do this, or 5, do this regularly as part of my routine. I think that's the goal, is having the habits and the activities of healthy living be something that is routine for you. This is something that you just do without having to think about it. And so what I love about this, and that might be helpful for people in the community and young people especially, is to know specifically, for physical activity, exercising at least 5 days in the week for about half an hour. Again, these particular tasks are time sensitive and they're specific. So it's not just, oh, go exercise, but it's like, these are some things that you can do that's specific. Being able to, have a rainbow of colors on your plate when you're eating, so whenever you eat, just look, how many colors do I have on here? Is it only 1 color, 2 colors? And that's a nice little, way to ballpark how balanced your diet is. How you're sleeping? Are you sleeping 7 to 8 hours a night? So this is something to keep in mind. I think it's helpful. And at the minimum, if you're able to get and rate your numbers here and score it here, this gives you instructions of how to score it and what it should look like. The ideal is for it to look like a big circle. But if it has all these little gaps here that, goes up and down, it just means that the parts that is a bit lower, you might need to upgrade a little bit more on. The parts that are already high, that means you got to recognize your game. So this person has some game and sleep. So it's just something to keep in mind, is you can take this to your healthcare provider, to your caregiver, and say, hey, how do I get my circle to be smoother? How do I get my circle to be wider and not so small? And I think this would be a good way to kind of start thinking about full wellness and holistic health.
That's fantastic. And you and I have talked before about how it's important that as providers, we don't just give that general advice about exercise more or eat better, but to actually write a prescription or give something to your patient that they can actually look at and do. Have you had success with that?
I truly have. I truly have. I'll give you this one example. There was a 10-year-old boy that came into our weight management clinic, and the prescription was written for him to spend 1 minute on the treadmill once a day. And for each day, for him to increase that to the point where he does 10 minutes on the treadmill. Do you know that we saw him probably about a month later, and he was so excited, so excited to come and show us how he had checked off each of the weeks that he was supposed to kind of meet that particular specific goal of 1 minute on the treadmill and 2 minutes on the treadmill and 3 minutes on the treadmill. Like, I feel like young people, again, if we think about the way that their cognitive mind works and their executive functioning, their reasoning and planning, logistical kind of brain, sometimes it takes a little while for them to be able to do that without specific instructions. And so I think in order to really appeal to the way that they learn and they recall and retain information, the prescription is really the way to go. Having them see it as a visual, having them feel responsible and be held accountable for it. It's almost like, look what I've done, and then us being ready to be their cheerleaders for when they come back and they're like, oh my goodness, I can't believe you were able to do that. No, actually, I can believe you were able to do that because I knew you could do it. So this is one of those things where, yes, the prescription, definitely a way to go. And I think it really is helpful.
That's fantastic. As we start to wrap this up, can we talk a little bit about treatment? So sometimes we have patients who actually have diabetes, both type 1 and type 2, and their numbers aren't always where we want them to be. Can you talk a little bit about why we're trying to get numbers in a certain place and any success you've had with the treatment to help people do better? So the one success you just mentioned about exercising more, that's fantastic. That's what we want to do before they even get the diagnosis. But sometimes once a person gets the diagnosis, it can be a little harder to be motivated to make the changes. Tell us a little bit about successes and things that you do to help people who actually have the diagnosis.
Yeah, definitely. I definitely would say, because I'm a primary care provider, I work in collaboration with endocrinologists and of course the rest of the team, nutritionists or physical therapists, and even social workers, because sometimes a lot of this is the psychological aspect of their relationship with food or relationship with just the family history or family dynamics or family culture. And so I think really having a comprehensive approach is really one of the evidence-based approaches to treating and managing diabetes. And so in my experience, there are medications that can help. There's always metformin for those who are pre-diabetic and sometimes even who are diabetic, who have the actual diabetic diagnosis. Metformin has been found to help, lower that glucose level in their system. But what we find is that medications by themselves are not enough. It really has to be a combination of factors that really allow it to be sustainable. Time and time again, the studies that we see have medications helping for maybe the first 3-4 months or maybe up to 6 months. But for it to be a longer term, there needs to be intensive physical activity regimen. There needs to be intensive nutrition guidance that cuts down processed foods, that increases the plant-based whole food diets that are available, increases the fiber intake that is in our system, increases the water intake that we're having, and also cuts down on the, we call them high glycemic foods that have high glycemic index. It just means that food that compared to glucose, they cause they have higher levels, they cause more levels of sugar to be released in the system than glucose itself. And so there are certain foods that do that more than others. And of course, I'm sure everyone knows fast food restaurants with high levels of certain fats and oils. But I feel like sometimes for our patients, it just kind of all becomes white noise to them. And it's just a matter of one stepping back to say, what is one thing that you can change? Especially like high sugar drinks, or sugar, high sugar drinks, basically high fructose, things with high fructose corn syrup in it. But it's like, how can we cut that down? Even if it's just by one, and not to say that you eliminate it altogether, but it's just really small steps towards that. Another point in terms of reversing diabetes or things associated with it is your sleep. Did you know that the amount of sleep that you get allows certain hormones to either rise or fall overnight? For example, cortisol. Cortisol is one of the hormones that is tied to glucose control, and sometimes stress can increase your cortisol levels, but lack of sleep can also increase your cortisol levels. And so some people don't really see sleep being tied to diabetes, like, what, I'm a workaholic, or even for students, I gotta stay up late because I gotta do all these exams. It's all connected. Your body needs that sleep to be able to regenerate, rejuvenate, and heal. But there's certain things that either get up-regulated or down-regulated when we're not allowing ourselves to be in a holistic healing nature. So it's all tied together, but there is evidence to show that when we're doing these lifestyle behaviors and really having a support system to help it be sustainable, it can treat, it can prevent, and it can reverse diabetes.
Fantastic. So I heard two really important things. Number one, that we don't do it alone. So diabetes and most chronic diseases, it's not just one person, but it takes a whole community to make a difference. And then two, there are medicines that can help, and talking with your provider and working through it is really important. And I also want to be clear for everyone listening, there are two types of diabetes. There's one where you're not making insulin. That's what we usually see in the younger people. But we've been talking today about type 2 diabetes, the one where your body has insulin, but your body's not using it correctly. So all those lifestyle, all those holistic changes make a really big difference to allow your body to use the insulin that it's making. Well, this has been absolutely fantastic. Do you have any last thoughts, any last tips you want to say before we wrap it up?
I think all in all, it's important to have young people learn ways to take charge of their health, but it does not mean that the caregivers are not still as important. It's still important for them to not just model some of these behaviors, but also guide and redirect when they see their young people, not necessarily following the recommendations. However, it's about guiding them in love and guiding them with reason and helping them understand the reasons why you're making, your demands. But all in all, it does take a village, and caregivers should see that the kids are listening. They're watching first, more so, but they definitely are listening. So do not give up on your encouragement and your guidance.
Fantastic. Thank you so much, Dr. Ifuribe, for both your time and your expertise. This was wonderful.
Thank you. My pleasure. Thank you for this opportunity.
Yeah. And I want to finish by thanking you, our audience, for listening in today, wherever you are. ABPA wants you to know that in order to continue our mission to try and eliminate health disparities within our community and inspire and nurture the next generation of Black doctors, we need your help. We need your input. So please leave a comment or send an email to info@austinbpa.com or visit our website at austinbpa.com. If you or your organization would like to partner with us, we'd love to hear from you. Again, thank you very much.